All right. Hello, everyone. Thank you for joining us for our first Earth Month program in April. Confused about COVID, reopening with Resiliency. My name is Elizabeth Newbern. I'm an administrative assistant here at CALS, and I will be your moderator here tonight. We are joined by April Ambrose, who is the Business Development Manager at Integrity. She is also a LEED Fellow and a Green Classroom Professional Faculty. And her big claim to fame is that she's the founder of Arkansas's first Earth Day celebration, which is really cool. And I've been really fortunate to have the opportunity to work with her through the Green Team here at CALS, which is our staff initiative to promote sustainable practice. But I am going to go ahead and let April take it away from here. She's got a great presentation planned for you guys.
Thanks, Elizabeth. I appreciate it. And I'll back up and say I didn't do the first Earth Day. The first Earth Days are in the 70s, but I did do the largest Earth Day in the state, I believe. So Earth Day has been going on for a long time, as it were, and is celebrated in a lot of different ways across the state. So I am a business development manager at Integrity. I was the first employee when we started the company in 2007. And I also founded our Memphis office about 8 years ago. We've got about 8 offices now. So very exciting growth within our company, to say the least. And I love that we're rooted right here in Little Rock. So, you know, just a year ago, COVID wasn't on any of our radars, and now everything has changed. We're all sort of learning as we go and being inundated daily with new information about when to reopen and why to reopen and how to safely reopen. And so that's what we're here to talk about. Ideally, we want to help you do everything you can to eliminate the occurrence, but we really can't do that. What we can do is help reduce the spread of the disease. So each of our services that we're going to talk about here have been developed using best practices and research from the CDC and other World Health Organizations. So I can't claim that they're going to eliminate COVID from your facility, but we are going to find ways to improve your indoor environment to reduce the potential for the spread of COVID-19 and other infectious diseases. So the first thing to note is how small the virus is. It is less than 0.3 to 0.6 microns in size. So that makes it too small to travel very far on its own. But it does love to hitch a ride on particulate matter in the space, like dust and dirt or respiratory droplets. So it's important to keep in mind that the more particulate matter you have in the space, then the more likely the virus can be transmitted further. So there you go. There's that tiny little micron size. Obviously, these are approximate in terms of scale. So this shows how COVID spreads in spaces. So you've got different modes of transmission: droplets, aerosol, direct and indirect contact. And each of those has to be mitigated in different ways. So the largest virus carrier are the droplets, because those are the largest, but they generally fall to the ground just a few feet out from the person who expels them. So it's very easy to mitigate the transmission that way through social distancing, wearing masks indoors, and ionization, which we're going to talk about later. Aerosolized can hang in the air for up to 3 hours. So ionization, which we're going to talk about, can actually pull those down to surfaces that can then be disinfected to kill them. So proper ventilation and air filtration systems will also mitigate the aerosolized movement through the space. Direct contact, no hugs. That's been like the hardest part for me. No hugs, no handshakes, no direct contact obviously mitigates that. And then indirect contact is to have high touch surfaces regularly cleaned, no touch fixtures, and we're going to talk about some of those types of things as well. So interestingly enough, the coronavirus is actually really easy to kill. It is a very unstable virus, which puts it at the bottom of this sort of hierarchy list. So we're not talking about having to use hospital grade disinfectants, because we know that even just soap and water will kill this. It's kind of a lipid covered, and all you have to do is break through that little fatty lipid and you will be able to kill it. So it's important to understand the 4 elements of indoor air quality. And I'm kind of setting this up so that we can have longer discussions later, but you know, how do the 4 elements of indoor air quality affect our comfort? Well, element 1, you've got dust and dirt and pollen, and then you can see some of the effects that those have on us. Element 2, germs, bacteria, and viruses. Element 3 is toxic gases and odors, and element 4 is humidity and temperature control. So when we're talking about indoor air quality, we're really talking about it as it relates to our health and comfort. We know that outside air is declining worldwide from different human activities. In fact, polluted air is the leading environmental cause of premature mortality in the US. So polluted outside air coming into a building with poor ventilation, maybe some indoor combustion emissions, gas appliances and that type of thing, leaks, and VOCs. VOCs are volatile organic compounds. The best way to think about them is if after you have that new building smell, you walk in and you smell the paint and things, those are usually volatile organic compounds that you're smelling. All of those things are contributing to our deteriorating indoor air quality. In fact, indoor air quality VOC levels can be 2 to 5 times higher indoors than outdoors. And so the result of all of this poor indoor air quality is a mix of health symptoms that can lead to a reduction in work productivity. And of course, the phenomenon that we know is sick building syndrome, where the building is actually making us sick. So why does poor indoor air quality matter? Well, given all of that, it's also important to know that about an average of 90% of our time is spent indoors. In the US alone, more than 120 million employees spend an average of 8.1 hours working in a building per day. And accordingly, the staff costs typically account for 90% of a business's operating costs, not the building, it's the people in them. And so, you can have some immediate effects, irritation of the eyes, nose, throat, headaches, dizziness, fatigue, but long-term effects, respiratory diseases like asthma, heart disease, and cancer. So what we are looking for is not only improving the air quality for all of these results that you see on the screen, but for a sense of well-being, to support social equity among all of our vulnerable populations, and reducing costs for a business, if nothing else. So productivity, if we improve productivity, let's say we spend just $40 per person per year on indoor air quality, that could result in a $6,500 increase in employee productivity. We can reduce morbidity and absenteeism, and it can reduce presenteeism, where people show up to work while they're sick because they need the income. We also know that people who work in well-ventilated offices have better cognitive function, and they actually score that way better, and they respond better in a crisis or to develop a strategy in a crisis. Workers also have fewer headaches and respiratory complaints, and even sleep better at night in a building with good indoor air quality. So how integrity can help, and I should have adjusted this slide to say, what can we do, right? This is something that integrity helps with, but there are a lot of companies that can do so. So very briefly about us, we are a buildings consulting firm. So this is what we do, is to help our clients have healthy, efficient, and safe facilities for all of their occupants. COVID made this a more urgent and specific need, but it's still what we were doing every day before. And these are some of the services that we provide to that end. So what we might start with is an investigation. So let's audit the building. How much energy are we using? Are there any infection control practices in place now? What are the goals of the occupants? Are we looking for just sustainability, using less resources, for example? Are we looking to be resilient in the face of this? And then come up with potential solutions, and then finance and bundle those together. And one way to do that is to leverage the savings from energy efficiency that you can use toward doing other things in the building. And those might be infection control strategies, but they could also be deferred maintenance or capital intensive things, et cetera. So the goal would be that if you spend so much money on energy there on the left, and then we can guarantee the energy savings that result from LED lights or solar or HVAC upgrades, now you have that big pocket of money that can be used to spend on other things. This is you may have seen in the news recently, the Batesville School District has been making national headlines. In fact, they were interviewed on weather.com today. They were able to give their teachers raises out of the savings that they generated from improving their school buildings. So there's a variety of ways to fund these things, but the important thing to think about here is that we want to look at the building as a whole. It's always difficult to look at things in isolation. So when you look at infection control, maybe you need to look at the entire building, and as you make upgrades that improve infection control, you can potentially pay for those from upgrades for other things, for energy efficiency. So, we would start with an audit, HVAC, lighting, plumbing systems, making sure they're being efficient, they're properly maintained. And then we'll look at all of the ways that we want to reduce the spread from infectious diseases. And I say infectious diseases because anything that we do to affect COVID is going to affect the spread of colds and flu and all sorts of other airborne circulated illnesses. So then we're going to come up with suggested solutions. So the cost and the payback of those, or the cost and the benefits, and then determine how to install and verify that those solutions are actually working. And that might be a commissioning or a retro commissioning, where you're ensuring that everything is functioning the way that it should, and that not only is the owner of the building trained in how those things work, but also all of the occupants as well. So you might start first with retro commissioning. Let's improve what we already have. Let's adjust the occupancy schedules. Do we have the air running all the time and cooling that building all the time when it could just be while people are in it? Changing the HVAC set point. Do I really need it to be 65 degrees in the summer? Could we do 67? Could we do 72? To make sure that everything is functioning correctly, the sensors, the equipment, even the water fixtures and the lighting. And then after you have improved what you have, then at some point, the best dollar spent is on renewable energy as well. And that is part of this resilience conversation. So these are the things that we're going to talk about that will affect the transmission of infectious disease. We're going to talk air dilution, air filtration, UV lighting, contamination mitigation. There's a variety of strategies there, just straight cleaning, and then the kind of back end, which is the testing, the monitoring, and potentially even the certification that the space has gone through these processes. We talk a lot about doing these things, and even when you're talking about doing energy efficiency, it's not very sexy and a very fun topic. So kudos to all of you that are here today, but also it's unseen. You don't see the virus, you don't see energy efficiency. And so it's important to make those front and center. If you're going to go through the work of improving your building to slow the spread of COVID, it really makes a big difference to help those in the building understand what you've done. It makes them feel safer in the building, and to help participate in some of the things that they can do while they're in the building as well. So this is an example of that whole building integration. It's kind of how all of these things are working together, but you wouldn't use all of these. You wouldn't have, filtration, ventilation, UV lamps, disinfection. You wouldn't do all of those things. So the EPA recommends 3 main strategies for managing indoor air quality. Remove the pollutants from the building, dilute the pollutants through good ventilation, and then filtering the air to make it healthier. So we're going to remove pollutants from the building. Those are the particulates I was talking about earlier that COVID can hitchhike with, by cleaning, wiping down surfaces, not letting the dust build up like I do at my house. Walk-off mats, making sure that you're removing pollutants from people's shoes as they enter the building. And then air dilution. So we're going to adjust our HVAC to increase the amount of outside air, fresh air that it's bringing in, and to maintain optimal antiviral humidity and temperature conditions. So we actually know that the virus thrives in certain humidity and temperature, so we want to stay outside of those zones if we can. And then filtration, HEPA filtration, bipolar ionization, and increased ventilation, as we talked about. So what you're seeing here is an example. We're going to talk about air dilution here, and this is actually an example from China, one of the first earliest cases that gives a really good example. So ASHRAE recommends maintaining the building humidity levels at 40 to 60%. And so the first thing that we want to do is bring in more outside air, but keep it in that range, right? Or outside of that range, as it were. So we also want to monitor to make sure that we are diluting it enough. And one way to do that is to monitor the CO2. So as we're all talking here, we've got carbon dioxide spewing out. If we were all together in a small room, hopefully that room would have a sensor that says, ooh, the carbon dioxide is peaking. We need to bring in more fresh air into the space. So that's a sort of common practice for conference rooms, but it could be applied to buildings as a whole. So in terms of, how much outside air you can bring in as much as you want, but in our hot and humid climate, it's got to be conditioned, and that costs energy. And so there's a balance here between bringing in the right amount of outside air, but not unduly spiking your energy costs. And this is why, unfortunately, you're not going to learn in today's presentation the silver bullet. There is no silver bullet for every facility, and you really need an engineer or somebody to help guide you through how to address the issues in your particular facility. Even those of us who feel like we know something about this, trying to figure out how to apply it to the gym that I go to versus my house versus my office versus my kids' school are all very, very different discussions. So this is an example as well about how the airflow affects things. So in this case, you had a small restaurant. There were 10 patients from 3 families who dined at the same windowless restaurant. This is on the 5th floor of a building in southern China. And an article was released about this in the July edition of Emerging Infectious Diseases. It's an open access peer-reviewed journal by the CDC. So one person was sick and didn't know it. They're the dark blue dot there. 2 other families sat at adjacent tables about 3 feet in between each table, and they were all there for about an hour. And in this outbreak, the droplet transmission was prompted by air-conditioned ventilation. So in this case, the key factor for infection was the direction of the airflow and recirculation via the exhaust in the return. And so that's what you see here. So you have the air pushing through, and then the exhaust was recirculating that. And so it just kept going on this loop on this path. And that's why the rest of the diners in the airflow path were infected. Very interesting study. So, we've also seen, since this was published, we've also seen in some restaurants where they just had fans going, and the fans, somebody sits in front of the fan and all the people in that path received it as well. So diluting the air and bringing in more outside air where you're not recirculating the same is the intent here to prevent this type of thing from happening. So air filtration. There's a lot of different types of filtration. So we hear a lot about HEPA filters. Well, HEPA gets about 99% out of the air, of the particulates out of the air, but it can only filter the air that moves through it. Bipolar ionization actually sends charged ions out into the space to sort of magnetically attach to those particles and either make them inert and they'll fall to the ground, or they move with, help them move back to the filter, make them heavy enough to move back to the filter. And then of course, the air still has to be moved to the filter in order for those to actually be removed from the space. Particulate control charges the particles that don't get caught in the filter the first time. Maybe they were too small. And then it keeps it sort of attaching to these small particles until they're large enough to be removed by the filter. Kind of like it actually kills them. It's kind of like a bug zapper. So those charged particles then get killed. So the effect in this case is actually measurable through a particle counter, where we can just count the numbers of particles that are coming out after the filter versus before it, et cetera. The biggest challenge in this case is that filtration doesn't catch what's on surfaces unless they can somehow be moved back to the filter. The other thing is that the particulate control can be really expensive. So bipolar ionization is often better for most uses. The good thing though, it's always cleaning. And what does make it to the filter, is 99% effective at killing those particles. UV light. So the important thing to think about UV light is intensity and time. So it has to have the right intensity to kill the particles, and it has to have that right intensity at a certain amount of time. So 30 minutes might be, at a lower dose, might be just as good as a high dose for a few seconds. And that higher dose UV is actually more expensive. So if I were going to put UV in my HVAC where it's killing things that are going through the ducts, then I have to have really high intensity because it's moving through that ductwork so quickly, versus having a lower intensity UV in the space, and it could just be on for longer periods of time. So the UV light actually inactivates dangerous microbes by destroying their ability to reproduce. And so they can prevent the spread of bacteria and mold, as well as viruses and fungi. The far UVC light is a really specific spectrum of UV lighting that attacks these airborne and surface microbes, and it's safe for human exposure. It does can deteriorate certain types of surfaces. Kind of soft surfaces, rubbers, and that type of thing. So you have to be careful in the space that you have what it's being applied to. But because it's safe for humans, it can offer continuous protection in a wide range of applications. It kind of creates a inhospitable environment for these things to grow and spread. So, the good thing is that these can be permanently installed fixtures. They can also attach to HVAC, or they can be a mobile unit in the space as well. The challenge is they can't clean what they can't see. So if I have a UV light up here, sorry, you can't see my hand. If I have a UV light up here and I have a desk here, it's not going to get anything under the desk, as an example. So these are just some examples of some of these things in the space. So you can see that there's the HVAC attachments. It's effective for all that, the things moving through the duct, but the cons, it's either not enough time or you have a really high cost to have it have enough time to actually kill things. If you're going to have a permanent installation, while it is safe for people, it's not usually very fun to have these lights on you all the time. And so it's better to have, in the case of this conference room, you have your event, and then afterward you turn on the UV for a period of time, but maybe not the entire time that people are in the space. And what you're seeing as well here are upper air technology. So there's a lot of different technologies to this end, and they can be employed in a lot of different ways. And what we're seeing as well, maybe, I guess, since COVID, that the cost is starting to come down on these significantly, making it a more attractive option across the board. Contamination mitigation planning. So this is how we utilize our spaces to a certain degree. So, examples, might be touchless fixtures. You've seen probably most of us are seeing more of those, toe fixtures that you see on doors to help you open the door without your hands, or automated doors. There are elevators that you can speak to. You don't have to actually touch the buttons. For plumbing, we're all very used to that. In fact, I have been guilty a number of times of taking my hands out the water and drying them before I realized it was not an automatic faucet. You had to use the handle. But the same for water fountains as well. Even HVAC controls don't necessarily have to be touched, and lighting controls as well. There are also real-time tracking technology and software where you can see where and how people move through the space so that you can adjust the space layout. So what you see on the left is an architectural firm that is saying that, just because COVID, even if COVID disappears tomorrow, we will have other infectious diseases in the future, and that the way that we plan and design our spaces is going to change forever. And they are starting to come up with designs that you can see these 6-foot bubbles, these designs that mitigate how people work in the space and how people move through that as well. You might also see, as we do, we sort of have dots reminding people of where to stand while they're in line for the coffee pot so that we're not automatically sort of congregating by default. There's also antimicrobial surfaces. Those could be smooth surfaces or actual physical degradation, things that degrade just by their very being, and I'll show you some examples of that. There's policies, green cleaning policies. One of the biggest issues that I have had with COVID, and especially in schools, is that based on our fear, we all want to use the harshest chemical we can think of. We want to use bleach on everything. But in reality, hydrogen peroxide can kill just as well as bleach can and has much less harmful effects to asthmatics and others. So choosing your products wisely can make a really big impact for occupant health and well-being beyond just COVID. Of course, there's the point of entry screening, which we're seeing a lot of. And then there's also just the communication, and the preparedness, emergency preparedness plans. I think when COVID first started and nobody was quite sure what to do, you go up to a restaurant and there were like 30 signs and it's like, what do I read? What do I do? I don't know how to act. I'm not sure what's okay here and what's not. So, having good messaging, but having it be concise and to the point and where people need to do something. I don't need to know what to do in the bathroom at the front door, as an example. Not quite as overwhelming. There's a lot that have also started doing it on screens because this information has been changing constantly and you have to keep changing out those signs. So having a screen that tells people can also be very clear as to where people are to look to learn. So emergency preparedness, what happens when somebody does get it? What happens when the majority of your staff gets it? How do you continue doing business? How do we plan for reentry? At what point are you going to have guests in the office in addition to your staff? And what do you do for your employees? There's a huge stigma attached to people getting this, and how can I support their mental health, not only their physical recovery? How can I reduce presenteeism in my office as well? And then last is sort of management buy-in. You can't do any of this without their buy-in, without some amount of financial support and a commitment to ongoing enforcement, not only to some initial preventative maintenance, but that ongoing buy-in that maintains this. So here's another example of some contamination mitigation. It's really funny. The picture on the bottom is very, very similar to our workroom. And our coffee pot's on the right end of that long counter there. And so we kind of have dots past the table. It's very, very similar. But you're not just designing spaces to reduce the spread. You're also designing spaces so that people feel physically and emotionally safe. I think people's perception in all of this can be just as important as what you're actually doing. So these are some examples. It used to be that maybe you had desks facing each other. Well, now you might want to turn those around and have them all facing the same direction. So you're not just coughing on each other, as it were. I think we've all gotten a lot more comfortable with having masks during a variety of interactions. It's not optimal, but we're finding it's not as horrible as maybe we thought it would be a year ago. Green cleaning and disinfection. So there's a difference here between cleaning and between disinfecting. So the cleaning is what's going to get rid of the particulates that the COVID particle can sort of hitch a ride with. Disinfection is actually killing it and other types of pathogens. So there's a couple of ways. One is just the classic wipe down. Another is fogging, and there are a number of different fogging things. Yes, you can do fogging with bleach, but you can also do fogging with hydrogen peroxide and without affecting machines or other sort of technologies in the space. You can do it precautionary, but you can also do it obviously after you've had an infected person in the space. The benefits is that this is very affordable. It's complementary. You can use this with other things that you may have going on in this space, like increased ventilation or UV light, et cetera. But it does require some really good training to make sure that people are wiping down the things that need to be wiped down. My daughter is in preschool, and the number of surfaces that preschoolers touch is very different from what adults touch. You can't just wipe down the toilet seat. It's got to be the whole toilet, right, for toddlers. So having, understanding that, training appropriate to the space is all very, very important to that end. And then I mentioned that there are some materials that actually work this way. So there are some, disinfectants or antimicrobial coating solutions that can be triggered by normal light waves or highly activated by LED or UV light. I'm, a little leery of coatings that are providing, that are actually actively killing things versus providing a protective shield that allows you to clean them better. We do know that some of those are cancer-causing agents, and so it's just, and I don't think we know enough about them necessarily. So I'm a little more leery of that, and I would lean more toward things like copper surfaces, which in and of themselves kill, or very simply just easy cleanable surfaces, as it were. So we can do all of this stuff, but we need to make sure that it's doing something, that it's effective, and that it's working. So we use indoor air quality testing as a guide to determine how well all of these strategies are working. So I mentioned earlier CO2 as a way to confirm that our dilution, our air dilution, is working. Obviously, humidity and temperature can also be measures of that. And particulates and volatile organic compounds can prove whether or not our filtration is working. So what you see here on the left are a few things. There's a handheld monitor, PID monitor, that can be used in your hand, and it gives you live feedback. You can also take samples and send them off to a laboratory, or you can use sensors in the space that will measure a number of things and give you that live data by sending it to a phone or a computer or a tablet or something of that nature. If you decide to use sensors, and these are becoming much, much more prevalent over the past year, you want to make sure that they are calibrated and that you can trust the data that they're giving you. So Reset is a new standard that emerged incidentally not long before COVID, and there are a number of sensors that are being verified by them so that you can trust that those sensors are actually providing you relevant data. So I also wanted to talk briefly about the occupant education and displays and dashboards. So this dashboard is called ARC. It is free for anybody to use for their building, not for residential. There's no database for residential. It's more for commercial use, but it's going to measure real building performance on 5 criteria: energy, water, waste, transportation, and the human experience. And it can pull in data from Energy Star Portfolio Manager or even live directly from your building. If you perform well, you can use this to lead toward a variety of different building certifications. What I love about it is it's engaging. I don't have to know anything about a building to know something about the building. In other words, I don't have to know what a LEED plaque is on the wall to know that it's a green building. I could look at this and say, wow, they're scoring really high and they're not using very much energy, people are happy in the building, et cetera. The other thing is that you can use this to compare very unsimilar building types. So I could compare a library branch, for example, to a very large Amazon warehouse, and we could have competitions between the two about lowering their energy and water use, for example. So the data that it tracks are energy and water utility data. It tracks the amount of waste that you're diverting from the landfill, say recycling or composting, et cetera, and how people are getting to work. Are they getting to work in electric vehicles or in gas guzzling trucks, or something of that nature? And then there's the human experience, which is a survey of the occupants about how they feel in the space. It's kind of a slider bar between happy face, frowny face, with the ability to check why and give feedback. And then indoor air quality testing. If you think about all of the things you might do to improve a building, most of those outcomes can be measured by one of these 5 criteria. So as businesses start to figure out how to re-enter their buildings, ARC has also created a set of resources to assist them called ARC Reentry. So ARC Reentry starts with plans and policies, and then you implement those plans and policies. You measure the occupant experience and the indoor air quality, look at that information and adjust your plans and policies. But this is also a way that you can certify your building so that the occupants know the process that you went through and that you are continually going through that. And it gives a score that you can translate and give to the occupants. Getting ARC Reentry can also get you points under the WELL building system. WELL is a building certification that says buildings should make people healthier. They should not negatively impact them. They should actually make them healthier. And then, of course, LEED, which has elements of human health in it, as well as the impact on the environment. So you can actually get credit under those rating systems for going through this process as well. And here we are at the summary, at the very end. There's no silver bullet. I keep reiterating that. I wish there were. If there were, we'd be done with this pandemic already. But every facility is different. Every facility needs a different combination of all of these solutions. And ideally, you know, when you're talking to somebody about it, ideally you find somebody who's agnostic and can help you work through all of those different solutions. Yes, if you talk to a lighting provider, they're going to suggest UV lighting. That's not necessarily a bad thing, but it'd be nice to have somebody that can help you look at all of those options for your facility. So there are some great engineers in our community that can help you to do that. I think that, you know, as well, figuring out how you're going to finance these things is important as well. And it could be that you can finance them through energy efficiency, which means that coming out of the pandemic, you could have a more efficient building that costs less to operate while improving the health of your occupants. So I encourage you to take a look at all of the different offerings that our community has to help you through these issues and to figure out how to make your building healthier and safer for your occupants.
Thanks so much, April. That was wonderful. It was a lot of information, but it was really interesting and engaging. So I really appreciate it. We do have a question from Mark Christ. He is asking, are there any funding sources to help pay for this?
So there are, you know, there are some CARES Act funding that applied specifically to hospitals and schools and other types of public facilities. In terms of a private, you know, company that's looking to fund this for their specific building, I know that they can get loans to that end, but I do not know of any grants that specifically fund it. And that's why we try to focus on finding other sources to fund it, like energy efficiency or solar production, or some of these other sort of financial opportunities for buildings.
Great. Something that kind of occurred to me while you were talking was we talked a lot about kind of more corporate buildings, but some of these things probably could work in a home, right? These are things that could translate. Obviously, not all of them, but I was thinking, I think especially for air quality control indoor in a place that you spend so much time, that's really important. So my actual question would be, how would you go about doing that in your home? Do you know?
I'm not sure that I do know, but I can tell you that what I did with our small gym. Our gym only lets 6 people in at a time. It's very, very small. And we put HEPA filters, HEPA filtration, just standalone units that plug into the wall, one upstairs, one downstairs, and then used a variety of fans to continue moving air through the space. Because again, you're trying to move the air to those HEPA filters. Most of our homes, HVAC units, will not hold a HEPA filter. They're too thick, they're too big, they don't fit. So you can increase the filtration in your home, but even then, getting a higher level of filtration reduces how quickly air can flow through it. So it can drop the pressure and it can actually cause harm to your HVAC units. So I think it would be better to get some standalone plug-in units and then make sure that you are circulating large volumes of air. Not quite a wind tunnel, but you should feel it moving, right? To get the air into those HEPA filters to remove it that way. And then, we've taken I've not done that in our own home, but we have taken a few other things. We remove our shoes at the entry so that we're not dragging those particulates into the space. We're maybe doing a little more dusting than I might do otherwise. And then we're also opening the windows periodically because most homes, HVAC units, do not have any outside air ventilation designed mechanically. They depend on the opening and closing of doors or even just the infiltration through cracks and things, which is not very energy efficient. But it does help to move fresh air through that space and keep it diluted. And that's why it's safe to be outside, right?
Right.
Outside is the most diluted you can get. So you still don't want to stand close enough to somebody that those droplets will hit them, but you're less likely to have some of those smaller droplets reach you because they're so heavily diluted by all of the other air. So those are a couple of things that you could do at home.
Great. I don't know if we have any more questions. I don't see anything in the chat. But again, thank you so much for this presentation. I thought it was fabulous. I learned a lot for sure. A lot of things that I didn't know to think about in terms of just the little things that are happening on the back end.